Welcome back, everyone. So, today we have a case of a known patient with appendicitis. He was admitted in the ER department with complaints of fever, pain in the right iliac fossa, and now the patient suddenly shows symptoms of relieved pain. The diagnosis was established on ultrasound. But what piqued our curiosity was why our patient has suddenly improved in pain. For the same reason, a CECT abdomen was ordered, and here we can see an appendicolith. This appendicolith has lead to the formation of the appendicitis, but now we want to understand why there is a relief in the pain. So let me just give you a brief about how the appendix and the appendicolith will be appearing on a CT scan. We'll see a dilated thick wall blind-ended loop of bowel, and here as we can see like this, and here as we can see that there is hyperdense calculi, or rather I would say appendicolith, which can be seen there. We can see the facial thickening due to inflammatory changes, and apart from that we can also see some free fluid and all. But now we want to search, we want to have a clinical suspicion if any perforation has occurred. These patients are prone to perforation, and then we want to search for the free air. So the easiest way to do that is to change the window and go as we see an HRCT. Now if we start moving down, we'll see only air. Only air foci will be visible. Let's adjust the window a little bit more. As we are moving up and down, we can easily appreciate the air in the bowel loops. But now we want to track for the free air, and here it is. Can you see this small bubble of air which is not surrounded by any of the bowel loops? It is present in the free fluid. Okay, so let's take back to the abdominal window. Can you see these micro air pockets here, like this? Here, these are not surrounded by the bowel loop, and as we go up here we can see this free air which is totally present in the peritoneum. So now why is this important? Because the patient had sudden relief of the pain. That means the perforation of appendix has occurred. Sometimes this perforation is not sometimes, rather I would say most of the times, the perforation of the appendix might not be visible at the level of appendix itself, and it is present, it is visible to us as these secondary signs of free air. We want to establish that the perforation has occurred so that we can immediately take the patient to the OR, to the OT, and we can perform an appendicectomy, because otherwise this perforated appendix would lead to a massive peritonitis as the time passes, and it will complicate the case. So, to find the traces of free air, you must remember the physics. The patient is lying flat on their back, so the air will come up front on the most anterior part. We were able to see the air obstructed by the liver and in the very initial stages. If given the time, this air will rise up and accumulate in the perihepatic space. In our case, the air rises to the most non-dependent anterior space. It will track up the right paracolic gutter as seen here. So if we'll go up, we might be able to see a little traces of air here as well. Much better seen on an MPR. You can see that the air is trying to go up, but as I said, this is a very early stage scan, and not too much of the air has leaked from the appendix. Again, as sometimes what happen, just after the perforation, the omentum also tries to cover that perforation, and that perforation might seal off on its own. But we don't want to take that risk. We don't want the patient to land up into massive peritonitis thinking that the omentum will do that. We need to inform our colleagues, the surgical department, that yes, the appendix has perforated and there is a huge risk of developing a peritonitis in the near future. So we need to switch to the lung window and see where the air and see if any free air is possible. Okay, so the takeaway point here is a sudden relief of pain, especially in a patient of appendicitis, is an surgical emergency, and it is not a cure. You will rarely see the perforation itself. To find the traces of air, switch to the lung window and check in the most anti-dependent spaces like the subhepatic region or the anterior liver surface. Then jump back to the abdominal window and see if these free air particles are surrounded by the bowel loops or not. Thank you so much. Have a nice day.